when people start to become more reactive to the babesia, then you can see more of like the irritable bowel syndrome. And, it makes sense. The capillaries feeding the walls of their intestines and the lining of their intestines have babesia parasites in them. And once they become immune, their immune system starts reacting. Now you've got inflammation added to the circulatory problem. And that makes them more symptomatic and gives them more positive symptoms, like diarrhea, cramping, and so forth, which is kind of like having more positive brain symptoms, which would be anxiety, anger, irritability, more severe brain fog.
Henry, welcome to the show.
Hello, thank you.
It's great to have you here for a number of reasons, but the one that I think is most probably relevant to a subset of people watching or listening to this is there seems to be these organisms. One is a parasite, one is a protozoa that infect the brain that we haven't really had a solid ability to test for until maybe the past 3-ish years. And so the one thing I'm hoping to capture people's curiosity with is that if you've had prolonged symptoms of, I think mainly neurological, but certainly not limited to neurological, but when I see prolonged brain-based symptoms, fatigue, insomnia, depression, anxiety, POTS, dysautonomia, that just hasn't responded the way it should if we thought it was driven by candida in the gut, let's say. If you're following this trajectory where things just aren't adding up, there's this degree of chronicity that kind of doesn't make sense. You feel like you have to work really hard to maintain a normal level of health. One of these organisms may have been missed, again, because testing is only in its infancy. And you've had personal experience with this, and like many people, that kind of thrusts you into trying to learn as much as you can, which is why I was so excited to have you here and to help educate us more about what's going on and what can we do to help the people, again, who feel like they're doing everything else and they're just not seeing their symptoms improve.
Yes, I'm into this whole realm. It got dragged into it, as you said, like many people do, because of my daughter's illness. And I took 2 ticks off her when she was 10 years old, and they were partially engorged. So they were on there long enough to have given her something. But nothing happened afterwards. No bullseye rash, no fever, nothing. But a couple years later, she started to have some depression. She couldn't draw the way she used to. And it was like her mental energy was low. I kind of chalked it up to adolescent problems at the time and changes in her life. But this went on for many years, and eventually she became disabled, and I had to figure out what was going on. And that's when I entered the whole realm of Lyme and co-infections. But eventually, Lyme treatment didn't work. She didn't have positive Lyme tests. But we got a break when the laboratory Galaxy Diagnostics found Bartonella antibodies, and then T-Lab with Dr. Mosieni found Bartonella henselae in her blood by fish test. But prolonged, intensive Bartonella only treatment did not help much, and eventually she. About a year later, she tested positive. Initially was totally negative at IGeneX, but the second time we checked, she had a positive babesia fish test, which means the organisms are there. They light up when the probe attaches to the organism's messenger RNA. And she had a positive antibody test for babesia at the same time, and it was for babesia duncani, which I did my research and eventually realized that was a cross reaction to the organism that was actually infecting her. And just, briefly, I figured it out because I called the Pennsylvania Tick Laboratory and I said, look, my daughter's got babesia in her blood. She's got a positive test for B. duncani antibodies. And the laboratory head was very helpful. She said, well, that's probably a cross reaction. And I said, with what? What's in the ticks here in Northeast Pennsylvania? And she said, we find Babesia odocoile in 20% of the ticks here. And that basically gave me the key to what was happening. I did some more research and found out how Babesia odocoile is likely a sequestering species. So it led me down the whole road of understanding Bartonella and Babesia. And they don't infect the brain tissue so much as they infect the blood vessels of the brain. So the capillaries are infested with Bartonella. And if you have Babesia, they also are infested with Babesia. And this very sophisticated Babesia species has this ability that I had to learn about from reading a lot of veterinary literature on other Babesia infections in animals, but especially Babesia canis in dogs. Since dogs are man's best friend, they got studied somewhat in terms of what happens when they get these parasites. And it turns out that this is very different than the Babesia microti that conventional medicine knows about. It actually creates these nests in capillaries throughout the brain, the heart, the lungs, the kidneys, the bladder, you name it, the intestines. Everywhere you have these occluded capillaries where the Babesia have gotten into red blood cells, have made those red blood cells attract fibrin to their surface. Fibrinogen changes to fibrin and attaches to the surface of these red blood cells. Now they become sticky. They get into a small capillary and they lodge there. And then more of them lodge after there, and uninfected and infected red blood cells essentially block up the capillary, and there's a lot of fibrin holding this mass together. And the Babesia can consume the hemoglobin in those red blood cells, can proliferate, can leave from there to try to set up a nest in another capillary somewhere else. And so you have this process whereby you have literally these parasite nests throughout the blood vessels of the brain and elsewhere. And with my daughter, it seemed primarily her brain was affected. And I have since seen this problem in many, many people, maybe 100 or so, because I had this endocrine practice that attracted a lot of fatigued and brain-fogged people. And once I figured out what was going on with my daughter, I started to see it in all of these people, and many of them got a lot of. I got a lot of positive tests also, and have been treating quite a few of them. And I can say I don't see chronic Lyme in any of them. Some of them had Lyme disease, but what I see always is the problem is Babesia and Bartonella. And amazingly, every time I see a sick person with babesiosis with this sophisticated species, odocoile, like I said, almost certainly, they also have Bartonella. Always I usually can get positive tests for both. So I never actually am sure that I have seen a person who only has Babesia or only has Bartonella. But the combination maybe is what makes people sick enough that, they end up seeing providers about their symptoms.
Sure. So a few points there just to sort of echo. Someone may have been tested for Lyme previously or even treated and said, and I've heard this, as I'm sure you have, a number of times in the clinic. I was treated for a year with pretty aggressive antibiotics, didn't get any better. It's because Babesia is not going to respond to those antibiotics. And then also the testing, the more traditional Lyme testing, even in integrative medicine that was using kind of progressive testing, could have very likely missed or not even tested for Babesia or Bartonella. And that's why I think for anyone listening to this, I want to be careful to disentangle, just like you said, Lyme, which is a different organism, Borrelia, from Babesia and Bartonella, different treatments and different testing. And this may account for why some people are having these chronic symptoms. And like you said, it's almost in a way a disease, if you will, of impaired circulation And with that comes a whole host of things, including mitochondrial dysfunction in the local tissues that are starved for O2, that are starved for nutrients. And so this is why someone may say, I only have a few hours of energy or of cognitive function, or I just don't have that cognitive speed that I used to have, or I need a tremendous amount of caffeine and nootropics to just have normal function.
Yes, I think that's almost always babesia, what you just described. It's very typical, and I saw it dramatically in my daughter, is that they have a few hours uh, and they're done. They hit a wall and they can't do anything else. But about the testing, just think of it. Lyme was first. That was the first vector-borne disease, tick-borne also, that people knew about, learned about. So we got the International Lyme and Associated Diseases Society. And still everybody thinks that every vector-borne disease is Lyme disease, or at least includes Borrelia burgdorferi or another Borrelia species, which we generally call Lyme. And then they get Western blot tests. And they'll usually not be positive. Very often they're not positive by Western blot, but they see a couple bands here or there, or they see a couple, especially IgM bands. And Dr. Mozieni and myself, we're quite convinced that many people with these infections, babesia and Bartonella, will get positive IgM bands on a Western blot. And so the doctors say, aha, you have Lyme. Look, you have positive antibody tests. Well, IgM is much less specific for the, particular organism for which you're testing. It's the first antibody that you make. It's less specific. So you get a lot more cross reaction with IgM. So a lot of people are misdiagnosed with Lyme disease because of positive IgM bands or one or two IgG bands. It's like reading through the tea leaves and finding any antibody positivity in a Western blot. So to find these two organisms I'm talking about, as you said, testing has been basically very poor until recent years. That we're just, have discovered that these organisms are infesting people chronically. And a few labs only have tests that can detect them. And so they are not going to get positive tests for Bartonella or babesia from any commercial laboratories. Their doctor can order B. microti antibodies from Quest or LabCorp, or B. duncani antibodies, or PCR for babesia. It will never show this particular infection because they don't know how to look for it. They don't do the right PCR. They only look for the PCR testing for species they know about. And they don't have antibody tests for this organism. And their Bartonella antibody tests are very insensitive also. So you basically have to get testing at IGeneX, Galaxy, and or T-Lab with their various tests for these two infections.
And by the way, if this has been helpful, please comment and subscribe. This really does help us reach more people who are trying to improve their health. So it is quite deeply appreciated. So Galaxy, IGeneX, and T-Labs, these are the labs that if you're working with a provider, you want to be asking for. The other thing, there's so many things, but one of the other things that I find interesting is Bartonella suppresses the immune system. And then this allows the parasite load of babesia to really flourish. And so together, they're much more problematic because potentially if it's just the babesia with a competent host, immune competent host, then the immune system is going to hold in check the proliferation like it does for many organisms from becoming problematic. But together, they really seem to be a pretty deleterious duo.
You're quite right about that. Did you get that from me?
Well,
I don't know, or from your own experience.
I initially got that comment from Tania Dempsey, but I think she may have taken it from your presentation from iLabs a few years ago. Yeah. So you may be the person who we should credit with this.
It's quite true. Dr. Breitschwert said that Bartonella has this lipopolysaccharide that milligram per milligram is more immunosuppressive than prednisone.
Wow.
And And indeed, I think this is what happened to my daughter, and what happens to many people is they have Bartonella first. As you know, you can get it from so many places. A recent study in Brazil found PCR testing, by PCR, Bartonella in 20% of blood donors. And that's insensitive PCR testing. I think the population numbers are 50% and up. And so I think what happens, people get Bartonella from, cat scratches and bites, fleas from their dogs or cats that bite them, and they scratch the Bartonella, into their bloodstream. So people get Bartonella first, or even in uterus. Both of these can be obtained in uterus. I feel more comfortable with Bartonella, but maybe babesia also. I know that other babesia species are obtained, in the uterus from the mother. So somebody could be born with Bartonella, and I think that happened in the case of my daughter. But they get Bartonella first, and so when babesia comes along, they have very little immune reaction to it. The babesia proliferates to a much greater extent, and so you get the problem, like I mentioned with these babesia nests. My daughter had very little immune reaction to the babesia, so I saw none of the classic babesia symptoms. That was misleading for us, because everything you read about babesia says, oh, you should have night sweats, you should have, air hunger, you should have fevers, you should have hemolysis, you should have a whole bunch of symptoms. Well, those only occur when your immune reaction has begun reacting to your immune system is reacting strongly to the babesia. But before that, it's, as you mentioned, you just have this sort of ischemia problem where your tissues and your brain are not getting energy. They're not getting nutrients. The capillaries are blocked. And there is some like local inflammation around the capillaries, which also tends to, by a certain mechanism, it tends to consume ATP and cause mitochondrial dysfunction. So if you only have a lot of the nests and you don't have a lot of immune reaction to the babesia, it looks more like hypothyroidism. And that's what I thought all these people had. And indeed, I could help them a little bit with armor, with T4, T3, or even just T3, because it overcomes the mitochondrial dysfunction to some degree. T3 really increases mitochondrial number and size. And so you're kind of fighting against the mitochondrial dysfunction by using T3 in these people.
Mm. Something else that you're making me think about is the history of someone who was doing okay. Then they had a period of intense stress. Maybe they had a kid or two kids, they didn't sleep well, or there was a really intense work period. And then all of a sudden, as Tania Dempsey says, people fall off a cliff. Now, I think traditionally we might say, well, it's your adrenals. Your adrenals are fried. And I think most people who are following the science are I hate that term, following the science. It harkens too much to COVID, but most people who are following sort of the research literature on adrenal pathophysiology understand that they don't dysfunction without some sort of primary cause, and the adrenals are usually secondary. And that makes me think of this presentation where it wasn't the adrenals that tanked, it was the immune system got suppressed enough to now you have this domino effect where Bartonella proliferates, suppresses the immune system, and then anything else that the immune system should be holding in check can now become either reactivated like Epstein-Barr virus, or it can have a higher load of parasite like babesia.
Yes, I think that scenario happens where there is some immune system suppression, but I often believe there's another scenario, and that is where the immune system becomes activated, or say hyperactive, because of a combination of circumstances. For instance, a very clear case is where people get COVID. And I don't think that COVID allows the babesia bartonella to proliferate. I think what happens is the immune system becomes more reactive to the parasites that are there. Because, like I said, there is the situation where you're just affected by the babesia and or Bartonella, sort of because of the nests, and you have some hypothyroid-like symptoms. But if you start to become also reactive to these parasites, you are going to become much more ill. And so I think often it's a case that the immune system has become activated for some reason that causes them to become more reactive to the chronic infections they've had. And one of the key ideas about these infections is these are super highly developed parasites. They want to live in us. They don't want to hurt us. They don't want to destroy our lives. Uh, and so they our system can live with them, and as you know, many people have them and are essentially asymptomatic. They're doing fine, uh, but circumstances may change, or in some cases they just get worse gradually over time, so that the parasites become a real problem for them, and then you and I have to do something to try to help.
This is a great point, and I want to come back to this in more detail a little bit later, but uh, what a gift this has been at the clinic for the people who they're so what we would maybe call sensitive or reactive. Now we're realizing that, you know what, that's not you're intolerant to XYZ ABC treatment or whatever. You're actually having some elicitation of an immune response. And so you're feeling poorly. But if we can just get you with some support to the other side of that, what will happen is those negative reactions will become less severe, less prolongated, and less frequent. And it's a huge, I think, unlock and these are the people for whom my heart breaks, where you lay out a therapeutic plan, you check in a month or two later, and they haven't been able to follow through on any of it because they said, well, I tried this, didn't feel good, so I stopped. I tried the other recommendation, artemisinin, didn't feel well, so I stopped. And in these cases, it seems the die-off can also be prolongated. It's not the sort of Candida die-off that I think the more gut-focused clinicians like myself are accustomed to of 2, 3, 4, 5, 6 days. This could be maybe a week and then a good week and then another bad week. And this cycle could continue for maybe even months, with some improvements along the way, but there might be this kind of tough period that they have to get through initially.
As I put it to people, again, it gets back to those nests. You have a picture there you can show of.
Sorry. Let's so we'll put up the visual of the nest, but I'd love for you to explain what we're seeing here with, you have a few slides. We'll go to the first one, the
yes.
B. canis.
B. canis. So this is critical to understanding what you just mentioned, which is how confusing and difficult it can be to try to treat these people. I experienced all of this in great drama with my daughter, and I've seen it over and over with others. And the key is understanding that the picture shows, again, veterinarians looked at babesia canis in dogs, and babesia canis does this fibrin bonding sequestration trick where it stays out of the bloodstream. So you'll never see it in a blood smear, as the CDC says, should be part of the surveillance criteria. You should have a fever, you should have a positive blood smear. That doesn't happen in sequestering babesia species, which are far more sophisticated parasites. So in that picture, that's from a dog's brain. They infected a dog, and this is a relatively new nest because they didn't wait months or years, which is what's going on in us humans when we get these babesia infections and don't get them treated initially. So capillaries throughout the brain, the heart, the lungs. He's got pictures in that paper from other areas. It's from a Shetter's paper in 2019. And so this is what you've got. And it's smart. It does not infest too many capillaries in the same place, because that could create infarction. So it only, infests a few capillaries. It probably knows a nearby one is infested, so it won't infest a very close capillary. And so you get these nests like this throughout the brain, the heart, the lungs, the kidneys, the intestines, muscles. And so you can get symptoms in all those areas. So when you start to treat someone with antimicrobials, you're going to kill babesia, but only the ones that are at the ends of the nests or that are in partially formed nests, which there will be many because they're always trying to form some new nests. And so you need to first kill the ones that are exposed to the antimicrobials, but you've got a whole bunch of them. The majority of them are sequestered in these nests. And so what you enter upon is a variable length of time, and it varies on each person. Treatment just has to be utterly individualized. Some people may do well enough with just killing off a few of the exposed babesia because their immune system has pretty well controlled the infection. But in others, you need to go after strong antimicrobial treatment to kill off, all the babesia that are in partial nests and at the ends of these nests. I'll stop there if the person feels well enough. And I say what I say about this disease. It's the craziest disease there is, because the only way to get better is to feel worse. You have to kill the parasites. They're trying to evade your immune system so they're not making you too sick. But when you kill them, you splatter their guts all over the place, and the immune system reacts and says, wow, there's a terrible infestation with a protozoa here. And so you get what's called the Jerish Herxiemer like reaction. It's similar to what happens in syphilis, only this is prolonged. And as a matter of fact, they will Herx more every time you add or increase anything that kills babesia.
And that, I think, is a key component just to underscore, because, putting myself in the patient position, if I didn't know this at the inception of treatment, I would say, this doctor doesn't know what they're doing. I felt a little crappy, then I felt a little bit better. Now I'm feeling crappy again. Then I'm feeling a little bit better. And now I'm feeling crappy again. This isn't working.
I got to explain everything, including the nests. I give them a, like a patient guide that goes through all of this. So they realize that this is not a 6-week treatment and you'll be cured. This is a lifetime undertaking. Now, most people, because I don't believe you will ever, when there's babesia, I don't think you can ever clear all of these nests. I don't think you can ever kill all the Bartonella, because they can also be sequestered and hiding in these nests. And I've seen dramatic situations where people with babesia still had, detectable Bartonella after 3 years of intensive treatment by PCR. So the point is, though, kill. Everybody is different. Their immune system reaction to the organisms is different. How many organisms they have and how many nests they have differ. And so you just enter upon this step-by-step process of beginning to kill some bugs. Let them know that anything they experience with taking antibabesials, including antibabesial herbs, whether it's feeling better or feeling worse, it's not a side effect. It's because they have babesia that these antibabesials are affecting them. And for that reason, I like to usually start with a atovaquone. And I use a atovaquone first because it's diagnostic. If you give them something that'll kill Bartonella and babesia and or Lyme disease or other bacteria, you won't have the diagnostic clarity you have when you give Mepron, because it's very specifically formulated to affect mitochondrial function in only malaria or babesia. It doesn't affect human mitochondrial function. And I don't see it having any side effects whatsoever. And I have to say that about most of these antimalarial, latest generation antimalarials I use, and or the herbals, they don't have side effects. So you're not having a side effect. The fact that you improved, and here's another very confusing bit. When you give people something that kills babesia or paralyzes them, at first, they may feel better for days or a week or two. And I call it shock effect. The organism is paralyzed. And so the ones that are exposed to your immune system, they become quiescent and they don't interact as much with the immune system, or they're just not as active. And so I've often seen people with the atovaquone feel better, and with tafenoquine and with herbals too, feel better initially, and think, oh, this is great. But then the injured babesia or Bartonella begin to die. Then the herxing starts. And it can be flu-like symptoms. It can be, generally, it's a worsening of all their usual symptoms. Brain fog gets worse. They may get headache, fatigue, joint aches. And they have to understand they have a parasite that will never be eradicated. We are starting to produce the process. Whenever they are herxing, they are killing bugs, and that's the good part.
Now, this may sound a little bit bleak prognostically, but I'm assuming that as we bring down the load, the objective is to get to a point where the immune system can handle the load going forward. So, we could also say Epstein-Barr or the chickenpox virus is never going to leave your system. So there's other examples of this. So I don't want people to think, oh my goodness, I'm branded with one of these bees, right? It's just something that you need help getting to a point where your immune system is strong enough. And then you can fortify going forward, meaning let's say you're coming up upon a period of stress. Maybe you do a prophylactic course of antimalarial herbs or antimalarial drugs so you don't have that same regression. Now you know how to fortify.
Yes, I must say that people differ, again, tremendously. Some people, all they need for you to do is kill off a few of the exposed bugs. Their immune system will get everything back under control, and they'll be fine. On the other hand, I see very different scenarios. Like I've gotten people much better on antimalarials, and they feel so good they stop it. Well, in 3 or 4 months they are back because everything is back with a vengeance, and they even seem harder to treat after that because they're now more reactive to the parasites than they were before we started killing them, and the parasites are back. I have seen a few who were able to stop and haven't had to restart for quite a while. So I do believe some people, can control it once you help them kill off a bunch of the parasites. And then there are those who just feel worse whenever they stop. They have to be continually on antiparasitic medication, or all their symptoms will come back. Their neurological stuff, their terrible fatigue, their brain fog, their gastrointestinal problems. So everybody is different, and so it really takes a individualized medicine approach.
How much do you see a correlation to someone's diet, their lifestyle, sort of the things that we know are going to be conducive to someone being more or less healthy? Is there a decently direct correlation to those things, or does it not track that tightly?
I don't see that strong. I don't see a strong correlation.
Okay.
I mean, diet, supplements, they're all good for you. But you know what's crazy? Anything that makes your immune system healthier can make you react more to the organisms. So this is why some people, you give them stuff that's good for them or for their immune system, and they feel worse. Even just vitamins and minerals. It's a crazy disease, and Michael, what it comes down to is the immensity and complexity of the immune system and its huge role in everything.
Sure. Fair enough. And to your point, we had a case like this just last week in the clinic where, again, learning to better steward people through these reactions, someone historically had observed that they were intolerant to the reparative peptide BPC 157. And we said, okay, let's give this a little while longer. Firstly, they were further down the road of antimicrobial therapy, so that they were probably in a better place, A. But B, we had a little more wherewithal. And what do you know? 2-3 days in, there was fatigue, there was joint pain. And by day probably 7, fatigue was gone, joint pain was gone. And so the person that had now been on BPC for about a month with no problems and probably some benefit because we understood, due to probably the immunomodulatory and inflammation modulating nature of BPC, that was akin to a die-off reaction vis-a-vis modulation of the immune system.
Yeah, it may have made their immune system, more strongly reactive to the parasite and therefore help it to kill off a few more.
Right. We hit a number of symptoms, neurological, obviously, fatigue. Do you want to say anything additional about gastrointestinal? Because I know this is something our audience is really cued in on.
Yes, it's huge. Just imagine you have. You can show that other slide with the babesia nests and multi-organ dysfunction, because gastrointestinal is listed there. And what I see early on when people are not reacting to the babesia, but if they have a very strong load of them, they just have, energy or lack of energy in their gastrointestinal system. So they're the ones, they're constipated. They're cold. They have very little energy. Their energy is used up in a few hours and so forth. But when people start to become more reactive to the babesia, then you can see more of like the irritable bowel syndrome. And, it makes sense. The walls of their intestines, the capillaries feeding the walls of their intestines and the lining of their intestines have babesia parasites.
Again, it's a circulatory issue. Instead of the brain being brain fog, it's the GI being bloating, constipation, irritable bowel.
And once they become immune, their immune system starts reacting. Now you've got inflammation added to the circulatory problem.
Right.
And that makes them more symptomatic and gives them more positive symptoms, like diarrhea, cramping, and so forth, which is kind of like having more positive brain symptoms, which would be anxiety, anger, irritability, more severe brain fog.
Coming back for 1 second to that first slide of the dog brain.
Sure.
We see this region where there's the fibrin bonding is a little bit darker of a color. It's more purple. Is this due to ischemia, hypoxia? Is it a lack of hemoglobin in the red blood cells? Help people understand sort of the left side showing a more purple presentation, and then there's a cluster of more red colored red blood cells.
Yes. A lot of the, what's in that nest is a combination of infected and uninfected red blood cells. So I have highlighted there that there are these nice pink-looking uninfected red blood cells. And this is part of what they call local proliferation. The babesia will eat up all the hemoglobin in a red blood cell that they've infected, and now there's a whole bunch of fresh ones, and they can move into them and begin to consume the hemoglobin within them. There's some controversy, by the way, among some babesia experts as to whether babesia consume hemoglobin, but I think it's very clear from my understanding and experience that they do consume hemoglobin, as malaria does. And by the way, this organism is very closely related to malaria, so it's like we have our own malaria here. It's called babesia.
Yeah.
And the pink kind of ground glass homogeneous looking stuff is the fibrin, and it is keeping that nest solid so that it doesn't wash away, and it in fact grows as babesia proliferate and more nests are added to the arterial end of the capillary. And after the capillaries, the post-capillary venules have very slow flow also, like the early venules that a few capillaries flow into, and they become infested with these fibrin-bonded babesia nests.
So a lot of the lack of energy is due to impaired hemoglobin function, which is going to carry oxygen. So for people who feel like your brain or your gut just doesn't work, this may be one of the reasons at a cellular level.
That's why.
Yeah.
As a matter of fact, I think that babesiosis should be considered to be the cause of severe exertional intolerance until proven otherwise. Because of the way it acts here, it has so much more ability to sap someone's energy than any other infection or process.
Right, right. With treatment, you had mentioned the antimalarials. I'm glad you made that distinction because I understand someone's trepidation regarding antibiotics. I think they have a time and a place, but this is a different category of drug or herb that is going to be anti-protozoal, anti-malarial, and like you said, they don't seem to have much. There are some side effects, but they're much more minimal as compared to many of the antibiotics.
Yes. I and they don't harm the gut bacteria, which is a nice thing. So, and usually, even if I know someone also has Bartonella, I will just give them pure anti-malarials to start with. And I would include among that more or less the artemisinin and the more potent RTM that Dr. Zhang produces, which is equivalent to 50 milligrams of artesunate. But tafenoquine is a pure anti-malarial. It's not going to kill bacteria for the most part. Same with atovaquone. And I don't see them as having side effects. It's always herxing in my experience. Tafenoquine is, I began to use that with my daughter because I had read animal studies, especially at that time, there were only a few mouse studies, but it's now been given to other humans in mainstream studies for babesia microti. And they say it's got some gastrointestinal issues that might occur in a few hours after a dose, but I'm not even sure that that's not herxing because you're exposing your stomach, your esophagus, and your intestines to a high level of tafenoquine, which is beginning to kill the organisms there. And I've certainly seen dramatic gastrointestinal herxing with tafenoquine so badly that it looked like there was a peritonitis and the person could possibly need surgery. And it was all just inflammation from killing bugs in the walls of the intestines.
So tafenoquine, I've seen, I think it was Horowitz who goes up to about 300 milligrams per day. In your notes, you listed
Per
up
week.
to per week. Thank you, per week. You've listed up to 600 milligrams per week. I'm assuming you're just finding, like many things, a higher dose is more effective.
Yes.
Yeah.
Yes. I've researched it thoroughly. Up to 2,100 milligrams was given to people in a dose finding test in malaria, and 450 milligrams weekly. The FDA approved dose for malaria is the dose for malaria. And it is actually, or preventing malaria, which is 200 milligrams a week after a 600 milligram loading dose. But there are studies that indicate that babesia are very much more resistant to antimalarials than malaria is. Much more resistant, 1,000 times, according to a study by Abraham in 2018, folks at Yale. So I have not seen any toxicity with much higher doses, which I had to resort to with my daughter to get the inflammation, herxing, and severe inflammation under control. So
I'm
I
sorry,
have people
Henry.
taking.
One question that you spur. There's different schools of thought regarding if someone's having a Herxiemer reaction at a given dose. Do you back off? Do you maintain? Do you push higher? Probably going to be individualized, but are there any principles you use to navigate that? Like when to go higher, when to hold, when to pull back?
Yes. I think the ideal approach that I try to follow is start low and increase slowly. And ideally, what happens is you kill off a few of the most exposed, most vulnerable babesia, and they have a Herxiemer reaction, herxing. And then once those babesia are dead on the same antimicrobial regimen, the herxing calms down. And if you're fortunate, they even see some improvement in some symptoms, although that may take more weeks or months. And then increase the dose or add another antibabesial. and then just continue that process, herxing, wait until the herxing calms down, increase the dose. And I would do that until they get to a point, and it could be months or years later, where they say, "Hey, doc, I'm well enough. I don't need to get any better." And then you can reduce to some kind of maintenance dose, which could only include some potent herbs like cryptolepis and RTM, Artemisia, but also could be a dose of 1 or 200 milligrams of Ericoda weekly or something, just to keep the organism suppressed.
So let's talk about Ericoda or atovaquone, another antimalarial. It seems that these two are often used together. In fact, it seems that 1 or 2 prescriptions along with herbals plus biofilm agents, kind of a comprehensive plan is what's the favorable approach. But atovaquone is another agent people should be aware of.
Yeah, it's the yellow liquid that a lot of people don't like the taste of or whatever, but it's very effective. It's the most sick people, Michael, I would start at 1/4 of a teaspoon a day, because they can have very strong Herxiemer reactions to atovaquone if they're very ill. But people who are doing fairly well can start at a teaspoon twice a day, and eventually, if insurance is helping them pay for it and they're tolerating it well, you can go up to 2 teaspoons twice a day. But like I said, I love it because I know it's a pure antimalarial, and I don't believe it has side effects of any significant kind. And people have to. Here's another problem, Michael. When people get their prescription, they read the FDA list of side effects, and I think it's basically herxing. Because who was prescribed these medications? People who had malaria, or people possibly who had babesiosis and didn't know it. And so what I see is that I just haven't seen any side effects to atovaquone that are not just herxing.
And you mentioned there. I guess there's a couple different forms of wormwood or artemisia. There's artemisia whole plant. There's artemisinin and isolate, and there's also artesunate, which I think is how you pronounce it, which is a prescription. On the last one in particular, does that come only as an IV? I think there's an intramuscular injection, but how are people administering that?
Yeah, we don't need to use IV. It's perfectly effective orally. And the way to get that, there are 2 ways, Michael. One is Dr. Zhang's clinic in New York City. If you call them up, they like to know you're working with a practitioner so that you can give them that information. They will sell RTM, ARTE-M. And it is equivalent to 50 milligrams of artesunate. And it is much, much more potent than artemisinin that you can buy over the counter. You probably, to equal one of those capsules, you may need 600 or more of artemisinin to equal one of Dr. Zhang's RTM capsules. And then the artesunate is available as a pharmaceutical product elsewhere in the world. And so I'll often hook people up with an Indian pharmacy that can get this stuff for them. And it saves them a lot of money. 100 milligram tablets, pure artesunate, pharmaceutical grade. So that is how I would approach the, they can certainly start with artemisinin, because again, the idea is to start low and increase gradually. So they could start with it and see if they tolerate it, and they get up to like the big doses of them where it's starting to cost a lot of money just to buy that much artemisinin, they can change over to the RTM from Dr. Zhang and see how they do with taking that.
Do you have any thoughts on artemisia versus artemisinin in terms of a few studies have looked at artemisinin and found hepatotoxicity, but they were also using other medications in those studies. So it's a little bit hard to say it's the artemisinin in and of itself. We did find other trials using comparable doses of artemisia, the whole herb, and there was no elevation of liver enzymes. So that's made me favor sort of a pulsing of the artemisinin, the isolate, along with a base of ongoing artemisia. Wondering if you have any thoughts on this.
Yeah, I have not seen any liver toxicity, and I don't think you'll see it if you look it up on liver tox. It's going to be a very, very low likelihood. I have not seen it. The only thing I have seen with high dose artesunate there are reports of neutropenia, but I also haven't seen that in people I've treated. Artesunate in particular, I don't know about artemisinin as well, but artesunate is very short acting. And that's actually kind of a good thing for some people with the herxing, because they will herx several hours after a dose, and that herxing will calm down several hours later. And it also therefore has a lot less prolonged, oxidant-like activity in human tissues.
Right. Okay. And there's some other herbals and natural agents I want to come to. I know our audience is probably pretty keen to learn more about those, but as it pertains to some of the other medications, there are antibiotics, azithromycin and rifabutin, that are often added in synergistically, especially if there's Bartonella. Any thoughts or anything that you'd want people to know about adding a antibiotic?
Yes. That does, of course, then bring up, some concern about gut bacteria, and you would tell them about probiotics, including Saccharomyces boulardii. But rifabutin rifampin rifabutin. Rifabutin is much more potent and penetrates tissues better. I think that rifabutin is much more effective for both Bartonella and babesia than is azithromycin. And I'm a little concerned about azithromycin's tendency to produce some ototoxicity, and it can produce a kind of an allergic hepatitis reaction in a few people. And also rifabutin is a little more of a narrow spectrum antimicrobial. It doesn't tend to produce gut problems with gut bacteria as much as azithromycin or doxycycline or amoxicillin. So I do like to use rifabutin, and I found it also to be very, very safe without producing significant side effects or without liver toxicity also. And I do think the whole idea of liver toxicity is very much overblown with any of the agents I'm recommending. Um, Again, look up the liver tox ratings, and you'll see there's very little that's been actually thought to be liver toxicity related to these medications. And what you will see, though, is with very strong die-offs, people will get mildly elevated liver enzyme tests. And I think it is, again, just herxing.
Okay. And so you'd recommend monitor and hold the course of treatment, retest. Is that how you're handling this? Retest 2 to 4 weeks later, the enzymes again, or how do you interpret maybe a retest where you have 2x elevated liver enzymes?
If I will monitor them, depending on the person and how sick they are and how aggressively we're treating them. But even if they are mildly elevated, and another test that is very useful to follow when treating babesia is haptoglobin. Because when you're killing babesia in significant amounts, there will be evident hemolysis. And that can be seen with a low haptoglobin level. And it can also be seen in a urine dipstick test. They will see heme in a kind of a general pattern, which does not look like actual punctate red blood cells. So even if there is mild elevation of the LFTs, if I know we're killing babesia, I know they're doing fine, I will continue it very often.
Sure.
Because if you stop therapy every time you see a little LFT elevation or some hemolysis, people do this. They just say, "Oh no, it's dangerous, stop," and the person never gets any more treatment.
And what about things that bind toxins like psyllium, charcoal, classical liver supports like silymarin? Do you find these to be helpful?
I don't know. I don't. I'm, as Tania said, I'm an allopathic physician. I want to see the evidence. I want to see what studies have been done. to show that it's beneficial for this case or that case, or in any case like this. I would say that everything that's good and healthy for the body should be, maximized when you are basically fighting a war against a parasite and there's a massive immune activation. So if you know these things are good for patients, it's fine. But at the same time, you want to avoid overloading them with supplements and other interventions because they've already got several things to take.
Sure. Yeah, I think that's fair enough. Methylene blue. You were the first person I've seen mention methylene blue as also having antibabesial action. So I'd be curious
It definitely
to hear
does.
more about this.
It was one of the first medications, maybe the first ever for malaria. So good rule of thumb, anything that kills malaria is likely to kill babesia. I've never seen this contradicted, really. So yes, methylene blue also seems to be safe at any dose, even massive doses that turn your urine very blue. And it's an antioxidant. And it kills Bartonella and babesia. So it is something that could be added, particularly maybe if people are having a lot of trouble with methemoglobinemia, which is a known effect of tafenoquine. It's not anything that needs to be feared, but it needs to be understood. If people ramp up tafenoquine very quickly or taking very high doses, or if they're taking primaquine, which is a sort of earlier version of tafenoquine that causes a lot more methemoglobinemia, it might be good to add methylene blue, and I think adding it is just generally okay. Only concern again is expense and additional medication and whether it's really necessary.
And you're screening for that G6PD before you have someone go to above 50 milligrams per day?
No, before you give anybody any primaquine or tafenoquine.
Okay.
Or methylene blue.
Right. Okay. Alinea, ivermectin, these may have some antiprotozoal, or they do have, I guess, limited antiprotozoal action. Curious if you have any favoring for either of these.
Ivermectin has been shown in studies to have mild antibabesial effect, nowhere near atovaquone. If you look it up, they directly compared the two in a study. So it does have mild antibabesial effects. Alinea probably also has mild antibabesial effects, but I haven't seen any studies that verify this. I did see one study where they considered that it should be tried in malaria. There was some in vitro activity against some malaria organisms. So I know practitioners use it for babesia, so I believe it has. I think maybe it's in the category of ivermectin of having kind of mild antibabesial effects.
Sure. Okay. Biofilm. There seems to be sort of the typical fibrin metabolizing or digesting enzymes, your serrapeptidase, your lumbrokinase, your nattokinase. It seems a combination of the three of those is probably best. I think that's kind of what you've said numerous times, but curious if you have any nuanced perspective on that.
Yeah, I'll discuss that. I have learned to treat babesia in two phases. The first is purely with babesia killing agents. Whether you start, again, because you want to go low and slow, it's perfectly okay to start with some herbals. I've heard people herx very badly from cryptolepis, for instance. But once that herxing's over, and if you've increased it as much as you can, and they need more treatment, you add something else or increase. But I get them on a strong combination of babesia killing agents. That means we have wiped out a lot of the exposed babesia. So maybe what's left are only the ones that are, deep in the nests. If they are still not well enough, and again, I would wait until this point, because if you add a lot of fibrinolytics early, you're going to release a lot of babesia and can make people very ill. And you may not have enough killing agents on board to to kill those, to kill the babesia that are being released. So I believe in getting up to a strong anti-babesial killing regimen first, where they're improved. They're not herxing much anymore on what you consider to be a real strong regimen. And that could be, 300 to 500 to 600 of tefenaquine weekly, along with an Artemisia derivative, maybe along with Mepron, atovaquone, maybe also including rifabutin if they have BART and you want to go after that too at that point. Then if they need more improvements, especially if they still have, those ischemic-like symptoms, they just don't have the brain energy they need to get through the day, the physical energy and so forth, I would add in the fibrinolytics. And this, again, I saw initially with my daughter extremely dramatic effects from adding fibrinolytics the first time. After 5 or 6 months of the most potent anti-babesial regimen anybody had ever received, we added lumbrokinase at 2-3 times a day and saw just gradually increasing herxing, hemolysis with heme showing up in her urine to the point where her urine turned like a charcoal color. It was there was so much heme in it, and also I think residue from these nests, babesia wastes. Uh, so but for what I do with introducing those is get them on the killing regimen. If they need more, I say, okay, we have to go after the nests. So I will start them on something, maybe lumbrokinase, 1 capsule twice a day. From what I've seen, I think there is a hierarchy of potency, and one author in a newsletter quoted some lab that did a study where lumbrokinase was found to be more potent than nattokinase, which was more potent than serrapeptase. And in my view, I've seen that to be pretty much hold true. Lumbrokinase is very potent. I would introduce it first. And here's one thing that also can sabotage treatment, because a doc will add in lumbrokinase, and a couple weeks later, the person is much sicker. And they don't know why, and they want to stop therapy. And the doc, why? How did I make the person worse? I added fibrinolytics. Well, you're now going after the nests, and you're going after the majority of the babesia and releasing more of them into the bloodstream and killing them. And so you've created a herxing. But also what I've seen with my daughter and others is that clearing those nests will bring, new levels of improvement that they could not get with just continuing to the anti-babesial drugs.
Right. Right.
So gradually increase and wait, because it can take 5 to 6 weeks for the fibrinolytics to work their full effect in gradually dissolving more and more, of the ends of these nests.
Okay. What about these agents that reduce platelet aggregation? Something that I find interesting from one of the assays at T Labs is they'll give you a scoring whether you have a fibrin predominated biofilm or a platelet predominated biofilm. And so that got me thinking about things like feverfew, horse chestnut, ginkgo, some of these, or whether it's heparin also as a pharmaceutical that will reduce platelet adhesion. Do you ever integrate any of these?
No, not antiplatelet agents per se. Heparin also is a fibrinolytic, and so when given, especially in high doses IV, it will dissolve fibrin. Yes, I would say basically if it can dissolve fibrin, it is likely to help in this process. If it doesn't, it may not help, but I don't have much experience with using the items you mentioned.
Okay. Coming to some of the other herbals now, Artemisia and Cryptolepis seem to be two of the more favored. Obviously we've already touched on those. There's a few others. I'm wondering if you have any thoughts on Sida, Alcornia, Noni, Neem. Have you ever, or do you have any thoughts on these?
Yeah, because you sent me some, warning you were going to talk about that. I did some research, and the, these Noni, I think, primarily is an immune modulator. I didn't find anything that said that it kills, babesia or Bartonella. Neem does have decent anti-malarial effect. And it's quite fascinating. I found this article on herbals from Africa. They looked at 500, different herbal products and found 290 of them had anti-malarial effects. But the ones that were significant, were neem, which has got a Latin name, which I can't pronounce right now, and the cat's claw or bicolensis, Scuteria bicolensis, and Cryptolepis, and the Alcornia, you said?
Mm-hmm. Yep.
That has relatively strong anti-malarial effects. So these all probably also affect babesia, and some of them we know affect babesia, and certainly could be, used, especially early on. If you want to use something gentle that you're comfortable with, that you and the patient will not be thinking there are side effects going on, it could be a perfectly good way to start and see to what, where it gets you.
Okay. There's a short list of IV therapies that are interesting. One is SOT. Do you have any thoughts on, and I know that I believe it's RCG Labs, they will make SOT to whatever the organism is. So Babesia otocolii in particular, specifically, any experience, any thoughts on the efficacy? There's not really much formal research on this. It's more anecdote, but certainly, especially at this year's iLads, there were a few presenters, doctors who also had personal experience using the SOT therapy, and they made a pretty compelling case, but I'm curious what your thoughts are.
Yes, I was there. Were you there?
I was there virtually.
Oh, okay. Yes, I saw those presentations. They do, for SOT, they do need to know what the organism is, what species. Ideally, PCR confirmed. I don't know if I don't think they always require that. It does seem to work. But with babesia, you've got the nest problem. So SOT is not going to get, penetrate into nests any more than the medications we use, as far as I can say. So, and it's expensive, and it's injections.
Sure.
And my view is, why go there when we have, perfectly good oral medications that the patient may be too potent even for the patient to tolerate. So let's kill all the babesia we can with the tools we have, and or Bartonella.
One I'm really curious to get your thoughts on is hyperbaric oxygen therapy. I can see a case for, I can see a case against. It seems most people, namely if I look at Horowitz and Burrascano, they've commented that it's probably supportive and neutral to beneficial. There is some evidence, of course, that given babesia lives in the RBCs, it likes oxygen, and maybe hyper oxygenating the blood would feed babesia. I kind of weighed that against the immunomodulatory, pro-mitochondria, all the benefits I think may outweigh the risks for babesia, but I don't think anybody knows for sure. Where do you land on this?
I have personal experience because I bought a chamber for my daughter to use, in our attempts to try to get her life back. She was on Dr. Mosieni's rifabutin protocol at the time and was herxing badly. She did do like 50 sessions of HBOT. She could get a bit of herxing after sessions sometimes. Overall, it was of no apparent benefit, but she had babesiosis that was not being addressed at all. And I have looked at the research on HBOT. it is more effective. There is pretty strong evidence that it's effective against Lyme, which doesn't like oxygen. That it is anaerobic. There is far less interesting information on babesia or Bartonella, which are both, aerophilic organisms. As you said, they live in the blood. They don't, oxygen doesn't hurt them much. But even with them, it is possible that high concentrations of oxygen, maybe at higher pressures than 2 atmospheres, maybe up to 3 atmospheres, which I heard from an HBOT guy, can actually start help to kill those organisms too. Because here's one of the ways we kill these bugs. They do not have the antioxidant capabilities that our cells do. So we overwhelm them by, using tefenoquine. Artemisia also uses iron radicals to create oxidative effects. So we overwhelm their antioxidant capabilities, but our own cells are able to cope. So I suspect that at stronger atmospheres and 100% oxygen, probably you get some killing effect on Bartonella and babesia. Certainly you do for other organisms. And I do think that there is lots of very good evidence that, for instance, there was HBOT was studied in mice with cerebral malaria. So that's the extreme version of having nests in the blood vessels in the brain. An interesting side show is that falciparum malaria, the worst malaria there is the worst because it's a sequestering malaria species. It does what Babesia ordicoile and Babesia canis do, but it doesn't use fibrin. It uses these adherent protein knobs that it causes to form on the surface of a red blood cell. So anyway, in cerebral malaria, they found that HBOT allowed the mice to live longer and not to get cerebral malaria as badly. They think it helps heal the blood-brain barrier. It helps healing of the brain in general. And it's very good to use, I think, when one can. And yet, of course, one has to be addressing and clearing the infections to get the real benefit.
Right. So, yeah, I think important to mention, it would not be a standalone therapy. Do you agree that you may want to reserve this until maybe mid-phase? I've heard some make the comment, wait until you have some of the infection under control. And it kind of connects with what you were saying about the anti-biofilm agents, is that you want to get some of the load down first so that you don't overwhelm. Is that your speculative recommendation?
I would say it's just a prudent approach. Is make sure you know what the infections are. Make sure you're killing the organisms. You're lowering the infectious load, and then I would think introducing the HBOT would be therapeutic, help the body and the brain in particular to cope with the inflammation, the disruption of the blood-brain barrier, and improve the healing process.
And then there was one paper that commented, this is more so for Bartonella, but if in a biofilm there's going to be this hypometabolism, introducing a high level of O2 could sort of turn on the metabolic function of the biofilm and therefore make it more likely to sort of ingest the antimicrobials that are trying to penetrate. So, I mean, it's speculative, but it's interesting to think that perhaps the activity, the metabolic activity of the biofilms could be increased and therefore more amenable to killing with this hyper O2 from the chamber.
Well, the biofilm itself is inert material. I think you may be talking about the organisms within the biofilm.
Yeah. Thank you for clarifying. Yeah.
Yes. I don't know.
Maybe, right? Yeah.
It's an interesting speculation. And oh, by the way, I have to say, and you and I would agree, there's so much we don't know. What we don't know is more than what we know.
Yeah.
All I can talk about is what I've learned by experience and by reviewing all the literature I could find, but and pretty unique and intense experience personally.
Sure. There's also modulation of nitric oxide, and some people recommend using things like arginine that are pro nitric oxide. Do you have any thoughts about if people should be or should not be using these sorts of
Yes,
therapies?
I did a lot of research in that regard. There, it's complicated, um, but I did use L-citrulline, which in my research was thought to be a better way to boost arginine and thereby nitric oxide.
Right.
But there's a lot of malaria literature, like in cerebral malaria, where they think that excess nitric oxide is part of the problem, and that it is created by the inflammation going on. The macrophages produce it to try to kill bacteria and malaria, and it can diffuse into the brain and kind of create some problems with brain function because it's naturally there. It can affect neurotransmission in unusual ways. So, and I can say I tried high dose citrulline on my daughter, and I never saw that it produced any real benefits. Also, where these nests are, excessive nitric oxide production around the nest can make the endothelium a bit leaky and helps explain edema and hypotension in people with babesiosis. They get some general puffiness and low blood pressure, which is probably also a central mechanism, the POTS.
Right. Right. Okay. Okay. Yeah, and maybe speak about POTS and sort of dysautonomia for a moment, because this is something that, again, as we're learning more about this at the clinic, we have another tool to bring to the people with autonomic dysfunction, which is screening for these organisms and treating them.
Yeah, you can show that Babesia Bartonella Herxing slide or flaring slide. Because in my daughter, at least, we found that the POTS was greatly worsened, specifically by low-dose immunotherapy using Babesia antigens. I imagine you're familiar with LDI.
Mm-hmm. Yeah, but maybe
Uh,
define it for the audience.
yeah, low-dose immunotherapy involves truly these homeopathic dilutions of Babesia antigens, basically, ground up Babesia organisms of several species, or ground up Bartonella organisms or Lyme organisms, and you dilute them to tremendous levels, uh, hundreds and thousands and tens of thousands and more times, and you just put a little bit under your tongue, and it can elicit immune reaction to that organism. Hopefully, actually, kind of fooling your immune system into thinking this is food. You shouldn't be reacting so much to these things because it's coming in through your oral mucosa. And so I did see dramatic effects at times with my daughter where the first correct Babesia LDI dose, she had a week in which she could do things. We went shopping. She could walk through a mall for hours and look at clothes. It was unthinkable before that.
Mm.
But because she was infected and not being treated for those infections, I think it wore off. Higher doses just made her flare. And then we eventually separated the antigens to separate Babesia before it was a Lyme mix the doctor was using. But we separated them into Babesia Bartonella antigens and gave them separately. And we saw those different effects it's very confusing when a person has both Bartonella and Babesia, because when you kill Babesia, you're also ramping up the immune system's response in general to the nearby Bartonella. And in my daughter, when we first killed Babesia, she had the mental symptoms you see there listed under Bartonella. She had those in spades with first trying to kill Babesia. My theory is just that Babesia can promote much more inflammation than any other infection, particularly when you disable it, when you kill it. It can be the most inflammatory by far.
Mm.
So I think that experiment we did with giving her separate babesia and Bartonella and seeing the improvements in herxing or flaring that occurred with both kind of may help people to see what causes what. And the POTS was very much more a babesia related phenomenon.
Interesting. Okay. And so for people with POTS or dysautonomia, something to think about in terms of what might be causal for those neurological symptoms.
Yeah, as there's a great article that I mention in PowerPoints. By the way, one of my PowerPoints is at my hormonerestoration.com website under chronic babesiosis. But there've been some very interesting studies done on these many issues. What did you just mention? I lost my train of thought.
The POTS and the dysautonomia being sort of secondary to the organisms.
Yes. It's what I was going to say is that one of the articles was by a veterinarian from 1956. His name was Malherbe in French, Malherbe, and it's the only thing I could find in all of the human and veterinary literature that described what chronic babesiosis with a fibrin sequestering species does. And so they described it very well in dogs. Basically, it can affect every system in the body. It can produce neurological problems, rheumatological problems, cardiac problems, intestinal problems, joint problems, muscle problems, headaches, and so forth. Well, dogs, they don't know headaches, but, they saw all these manifestations in these various systems in dogs with chronic babesiosis. And so they said it causes multi-system dysfunction. And in a way, it's, and like a great mimicker of other diseases and disorders. So that is what, to keep in mind is that when this person comes in with a list of problems affecting every system in their body, practically, you've seen them, doctors see them and they just think they're crazy. Think babesiosis, especially when there is fatigue involved, especially that low exertional or tolerance is the specific kind of fatigue babesia causes, where you get a few good hours and then you're done.
Right. No, Henry, this is, I think, a really timely conversation that I'm quite confident will help a lot of people because it's been underappreciated up until now. And certainly there's a lot more to learn. You mentioned your website. Is there anywhere else you'd want to recommend people if they wanted to read more from you or connect?
No, about babesiosis, there is my website, hormonerestoration.com, where I have a link to it there. I did a previous talk with Project Lyme, so they could, see if they can get some more information from that talk on YouTube. It's already been proven that Babesia otocoile infests people. There was a recent study out of North Carolina State where they found it in 7 people. And again, interestingly, found Bartonella in every one of them except one, I think. But the next thing is to prove that these Babesia nests do this in people. And so I have some autopsy specimens. I'm going to try to, get some fish testing to see if we can make slides and see if there are Babesia organisms, find the nests first of all in the specimens, see if there are Babesia organisms, maybe some special stains to show that there is fibrin there. But that's the next project, is not only that it infests people, but we need to show that it is a sequestering species, which is not proven in any scientific literature yet, but which I have seen dramatically evident.
Well, please keep me posted and open invitation to come back on once you've published that, because I would be very curious to explore those findings.
Thank you. And thank you for inviting me on to talk.
Absolutely. It's been a pleasure, Henry. Thank you again. And for all the work and your dedication, thank you so much, because I can't imagine the number of people that you're helping by bringing this awareness to the forefront. So thank you again.
Thank you.